the journalists whom have done really exciting job, written exciting stories around epidemics preparedness. And as we all know, this is the third in the series, I would say. And starting from when COVID hit, Nigeria Health Watch have been celebrating amazing and brilliant journalists who have really joined us in advocating for increase in epidemic preparedness funding. And the first one, as we know, happened in 2020/2021. The second was in 2021/2022. And the third is what we're witnessing today, which is 2022 into 2023. I want to welcome everyone and say that you just need to relax. It is a good evening and a happy one for every one of us. And as we go through this, celebrating these outstanding journalists, I just wanted to know that the advocacy or the voices that we all have been putting together to demand and to ask for funding for epidemic preparedness will not stop here. It continues. And we hope that we're going to have more funding through the national NCDC and other agencies to support the cause around epidemic preparedness. As we'll be starting right now, I would first of all want to welcome to the podium the Executive Director, Nigeria Health Watch. And before she comes up stage, I want to say that we are on social media. We all know that Nigeria Health Watch is heavily on social media, and we have a hashtag for this event and all our epidemic preparedness advocacy work, which is Prevent Epidemics Niger. And we also want everyone in the room to please engage using this hashtag, Prevent Epidemics Niger. And you'll be seeing some tweets that will be rolled out. We just want you to help us tweet, retweet, like, and also share with your network on Twitter and other social media handles. Before Vivian comes up, we'll be playing a video introducing Nigeria Health Watch. After that, we'll have Vivian for the welcome address. The video, thank you.
Print, broadcast, and social media to enable our advocacy efforts. Nigeria Health Watch is a non-governmental health communication and advocacy organization that seeks to advocate for better healthcare for all Nigerians. We are guided by the belief that health is a right and every Nigerian should have access to affordable quality healthcare. Since our inception in 2007, we have provided informed commentary and in-depth analysis of health issues aimed at advocating for better healthcare for Nigerians. We have worked to actively engage and support the government in raising awareness and increasing knowledge on a wide range of health issues in Nigeria. Our unique capacity lies in our communication expertise, using a wide range of tools including print, broadcast, and social media to enable our advocacy efforts. We have used our convening power to organize health policy dialogues, events, and webinars, bringing together policymakers and health experts to prefer solutions to the many health challenges in the country. Our evidence-based communication and advocacy has focused on health issues ranging from maternal newborn and child health, routine immunization, epidemic preparedness and response, universal health coverage, nutrition, and primary health care. We have worked with the following government ministries, development partners, and non-governmental organizations. We remain focused on meeting the health information gaps and needs of health professionals and the population in Nigeria. We are Nigeria Health Watch.
Please, a round of applause. Without no further ado, I want to welcome to the podium the Managing Director, Nigeria Health Watch, Vivian Ihekwazu.
Good evening, ladies and gentlemen. We're really pleased to have all of you here. I think watching that video really reminds me of the breadth of health challenges we face in Nigeria. It also reminds me about the hard work that we still have to do. And we're really pleased to have all of you here again. This is the third edition of our Prevent Epidemics Nigeria Award ceremony. I'd like to welcome all our distinguished guests. We thank you all for coming here and being with us this evening. This is a very important evening for us because we're really here to celebrate our journalists. Our journalists, as we all know, are critical in being the voice for people, being the voice holding government officials to account and holding us also, citizens, to account. For some of you who don't know yet a bit about our work, in 2018 we started the Prevent Epidemics Niger project. And really the aim of this project was, at that stage, was to advocate for sustained funding for epidemic preparedness and response. The work we do is through the support of GHAI. Emmanuel is here. We are very grateful for the support we've received in doing this work. But this work is very important because I remember back in 2018 when we started our Prevent Epidemics Niger campaign. And the purpose of it is to engage legislators, policymakers, to highlight the need that we as a country protect our health security. At that time, the idea of health security was not really understood, because when we think of security, what do we ultimately think of? We think of soldiers, we think of security in terms of guns and equipment, but security is never thought of in health terms. But I think every single person in this room can speak about their experience come 2020, when that word health security became top of mind, because we all had to live through what is continuing still, COVID-19 pandemic. And when that happened, I think that's really highlighted the importance of ensuring that we protect our health systems, and that if we do not have a well-funded National Public Health Institute, then we would be in trouble. And I think the NCDC really tried and responded in the best way they could. But even back then, if we think back, it was only in 2018 that the law, the bill for an act to establish NCDC was signed by Mr. President. And we're really pleased that happened back in 2018. Because had it not happened, then we wouldn't have had a legal mandate. So back in 2018, when we started this project, we engaged citizens, what do you know about health security? What do you even know about our Public Health Institute? People didn't really know much. Even speaking to legislators at that time, it really was not top of mind, which is why we're here. The media has been critical in being that voice for people. And the work we have done, working with the media through the support of GHAI, has been in training the media. Why is it important that we ensure that discussions about protecting our health security stays top of mind? And also training them in terms of the language, understanding the different issues that are happening in this area. I think all of us in this room, I almost feel like I'm preaching to the choir. So you all understand when we talk about health security. But really, this award ceremony, we started it about 3 years ago. This is the third one, and we're really pleased to be continuing. Because it's not often that we actually thank our journalists, because without their voice, how do we inform ourselves and how do we inform the Nigerian public? Health is not really always top of mind when people think about priorities, but everybody, no matter who you are, has some experience of adverse outcomes, or in terms of family members or otherwise, but also experience in trying to access healthcare. I think, as a country, we have been prone to concurrent health emergencies, outbreaks. Unfortunately, we're currently going through another one where we have diphtheria reported in about 4 states. And as we know, diphtheria is a vaccine-preventable illness. And if we have if we have a well-funded health system at the primary health level, let's just put it that way, then a lot of children would not have missed the immunization. But we have multiple challenges, and that being one of them. So knowing that we are always prone to outbreaks means we have to have a well-funded National Public Health Institute, both at the national level, but also at the state level. Because we know outbreaks don't start in town centers all the time. They don't start in airports. They often start in communities. And for that community to respond, it requires somebody, requires a health worker, requires a disease notification officer to notice it and report it. And it could be the smallest of things that prevents that being reported. Something as small as there's no diesel, there's no petrol to even power a car. So that's where we are. So health security is not just the responsibility of the national government, it's also the responsibility of the state governors, which is part of the advocacy work we do. And all of it comes down to funding, sustained and stable funding. And that is why we do the work we do. We were really pleased this year to have received so many really, really great entries, and I know that my team had to wade through them, as well as GHAI, going through the different categories, watching videos, listening to radio. I listened to quite a few and I was going through my emails, but we went through all of them, and we ensured that we were able to pick great journalism that really spoke to the issue. And we hope to continue and do more. And yes, we're doing this in this area, but reporting on health has to be important. We're right now in an election year. And when we think about going forwards, we have to hold our politicians to account. We need better healthcare in Nigeria. Our health indicators are not getting any better. And until we, citizens, hold them accountable, and as long as journalists keep on reporting about all these issues, then it will stay top of mind. So, I think I've given you an overview synopsis of why we do this and how we hope to continue. And I think all of us individually in the work we do are also advocates, and I hope that continues. I'd like to thank my team. I think my clothes are blending with the tablecloth. That wasn't part of the plan, but it's really great to see the great work that has gone into putting this event together this evening. And we're really, really pleased to have all our distinguished guests who have taken the time this evening to be with us. We're really grateful that you're all here, all our partners, journalists. Thank you all for being here. So on behalf of my team, I'll hand over for some goodwill messages. And thank you everybody once again for coming this evening and being with us. Thank you.
Thank you very much, Vivian. And thank you for that background on Prevent Epidemics Journalism Award. That was brilliant. Thank you, ma'am. Going over to the goodwill messages, we have quite a number of persons that are here and some who have sent their representatives. First, we'll be calling on the podium is Dr. Walter Kazadi, who is the WHO representative to Nigeria, ably represented by Dr. Victor Tugumizemu. Dr. Victor, are you here? You're welcome, sir. A round of applause.
Good evening, ladies and gentlemen. Hey, you are not responding, and she has just given us energizer, giving us all this about Nigeria Health Watch. It's a good energizer for us to have energy. Good evening, ladies and gentlemen. Good evening. Thank you very much. So, my name is Dr. Victor Tugumizemu. Can I rely on this? Okay. The job here is very simple, is to read the message of the head of mission and the virtual country representative, Dr. Walter Kazadi Murondo. And I will read it as is. In line with the protocol for this meeting, I'm glad to be with you as a special guest at the third Nigeria Health Watch Prevent Epidemics Journalism Award, tagged Celebrating Media Excellency for Epidemic Preparedness and Response, taking place today, the 27th January 2023. I must commend the management of Nigeria Health Watch for facilitating a strong collaboration with the media through the Prevent Epidemics Project to raise public and policymakers' awareness and demand for epidemic preparedness and build understanding and support among policymakers for dedicated epidemic preparedness funding. This event underscores the need to meaningfully engage critical stakeholders to accelerate and make Nigeria and the world safer from epidemics with advocacy and action, because we all know that epidemic outbreaks have multiple determinants, affect many people, and require action from all of us gathered here today. Every country needs to be able to find, prevent, or stop epidemics. However, the recent COVID-19 pandemic and other emerging diseases such as Lassa fever and cholera, among others, have revealed the gaps in epidemic preparedness of many countries, including Nigeria. If unchecked, they can lead to real disaster. Nigeria, therefore, needs a pivot to prevention in the fight against diseases by addressing the root causes of disease. As you are well aware, the World Health Organization was founded 75 years ago on the conviction that health is a human right to be enjoyed by all, not just a privilege for a few. Although much has changed in the last 75 years, that conviction is yet to be realized fully. Realizing WHO's vision for the highest attainable standards and health begins not in a clinic, nor in a hospital, but in the public places, households, and cities. We continue to support the government or the member states to make urgent paradigm shift towards promoting health and well-being and preventing diseases by addressing its root causes and building a strong, resilient health system to ensure health security. WHO member states face increasing numbers of emergencies with health consequences from hazards, including infectious disease outbreaks, conflict, natural disaster, chemical and nuclear spills, together with food contamination. Many emergencies can be complex with more than one cause and can have serious public health, social, economical, and political impacts. WHO has specific responsibilities and accountabilities for emergency operations under International Health Legislation 2005, and within Global Humanitarian System as Interagency Committee, Global Health Cluster Lead. Recently, WHO launched the $2.54 billion United States dollars for health emergency appeal to assist millions of people around the world facing health emergencies. As the health cluster lead for emergencies, WHO is currently responding to urgent needs of the most vulnerable population in 54 ongoing graded emergencies around the world. 11 of these are classified as grade 3. That is the highest level of emergency for WHO, requiring a response from all levels of the organization. Furthermore, a number of people in need of humanitarian assistance has increased by almost a quarter compared to 2021 to a record of 399 million people. As we speak, the number of high-threat infectious hazards continue to rise. Some of these are emerging, others are new. We are therefore facing new outbreaks as a result of vaccine-preventable diseases such as diphtheria, meningococcal meningitis, yellow fever, cholera, that have disastrous effects in areas where they occur, especially with limited infrastructure and limited resources. While there is no single pathway to epidemic prevention, all countries must find their way in a context that is in their own social, political, and economical circumstances. However, the foundation everywhere must be political commitment to building a strong, resilient health system based on primary health care with an emphasis on disease prevention and health promotion. Such health systems do not only provide the best health care outcomes, they as well provide the best defense against outbreaks and other health emergencies. From January to December 2022, the NCDC reported 1,067 confirmed cases of Lassa fever with 187 deaths. Up to October 2022, the number of confirmed cases of mpox was 604. Other diseases such as cholera, meningitis, yellow fever, diphtheria have burdened the health system as well. Currently, the country bears the highest burden of tuberculosis and pediatric HIV, while accounting for 50% of the neglected tropical diseases in Africa. Although the prevalence of malaria has declined tremendously from 42% to 23%, the country contributes 27% of the global cases and 24% of the global deaths. NCDs, non-communicable diseases, account for 29% of all the deaths in Nigeria, with premature mortality from the 4 main NCDs, that is hypertension, diabetes, cancer, and malnutrition, accounting for 22% of all the deaths. Distinguished guests, ladies and gentlemen, like the Nigeria Health Watch, WHO identifies media as a critical partner and is well harnessed as the potential to increase the achievements of health security in any country. Over years, we have significantly invested in communications for health in country offices and prioritize strategic communication within the 13 General Program of Work, that is GPW 13, that defines WHO strategy for the 5-year period, that is 2019 to 2023, that focuses on triple billion targets to achieve measurable impact on people's health in any country at any level. Within this mandate, WHO in December 2022 collaborated with the Association of Nigeria Health Watch to support and build the capacity of 50 of its members to leverage their role in strategic communication towards raising health on high political agenda of the government, empowering audiences, giving communication a voice, and creating a safe space for decision makers and citizens to discuss challenges and co-create solutions that address the challenges they face. In preparedness for the emerging threats from outbreaks, WHO recently supported the government of Nigeria to develop a workforce of 83 national level trainers from different sectors that is well equipped for strengthening emergency preparedness and response and ready to deliver coordinated, integrated, and equitable public health action in times of emergencies. The trained rapid response workforce is equipped to deal with any health-related emergencies. This is in line with WHO's commitment to strengthen regional and subnational capacities to prepare and respond to public health emergencies in an increasingly globalized, urbanized, and connected world where people, vectors, and goods all move together, giving rise to amplifying threats of a multitude of infectious diseases, natural disasters, armed conflict, and other complex emergencies. Additionally, WHO provided medicine and other supplies, training of doctors and other health workers, provided vaccines, enhanced disease surveillance, supported mobile clinics, mental health support, maternal health consultations, and many more. WHO delivers cost-effective, high-impact responses that protect health, lives, and livelihoods. In conclusion, I wish to congratulate and recognize the Nigerian media for their tenacity in providing accurate information to the public during COVID-19 pandemic, despite the volume of misinformation in the public space. The media plays a vital role in any society. They alert and inform the general public, and the recognition and awards for their contribution to raising awareness about epidemic preparedness funding and to enable effective response to infectious diseases are really well deserved. While I also want to congratulate those being recognized and receiving awards today, my expectation is that this award would further spur you perform better and provide more evidence-based service to the people so that together we'll continue to promote health, keep the world safe, and serve the vulnerable. Thank you, ladies and gentlemen.
Thank you, Dr. Victor, for this goodwill message from the WHO representative to Nigeria. And I must agree with you that there are so many misinformation in the public space. And that is the reason why Nigeria Health Watch is encouraging the media and journalists to keep pushing out the right messaging out there, to debunk some of this misinformation. Thank you very much, sir, for that goodwill message. The next will be from the Director General, Nigerian Center for Disease Control, Dr. Ifedayo Adetifa. He sends in a pre-recorded video, and we'll be playing that in a short while. Thank you.
Nigerian Health Watch team, gentlemen of the media, distinguished guests, permit me to stand on all established protocols. My name is Ifedayo Adetifa, and I'm the Director General of the Nigerian Center for Disease Control and Prevention. I am honored to join you this evening, albeit briefly through this message, to celebrate media excellence for epidemic preparedness and response. I am especially grateful to the Nigerian Health Watch for their strategic leadership, the initiative, and the strong collaboration they have in place, all in a bid to ensure public and policymaker education, specifically on the subject of epidemic preparedness and response. Words are not enough to convey the importance of this initiative and your importance, all you journalists in the House. Words are also not enough to express the gratitude of myself and other public health professionals who have enjoyed your role in being the bridge between us and the masses or citizens of the country that we serve. It's most definitely not been easy. Certainly this has required consistency, diligence, strength, and willingness to show up and keep at things to dispel misinformation whilst ensuring that accurate facts and figures concerning infectious diseases are churned out in order to educate the citizens and allow for all of a society approach in taking responsibility for protecting ourselves against these public health threats. I will keep my comments brief and close shortly by borrowing extensively from the British Member of Parliament William Lamb, and more recently from Peter Parker's Uncle Ben in Spider-Man, to remind you of three important points. The first one is you all have great power. The work you do has the capacity to stop infectious diseases in their tracks, or contrary, can be the amplifying factor in their transmission. The second point I need you to remember today is that with great power comes great responsibility. It is critical, absolutely essential, that you only amplify credible information about infectious diseases and other public health threats. It is important that you ensure balanced reporting, even for the controversial or unclear subject matters. And finally, we need to stay fresh. You need to stay up to date. Health reporting is a specialized area of journalism. This requires that you understand some basic concepts, and we will work together with you to ensure that you get all the help that you require to achieve this. We will continue to partner with you to prioritize infectious diseases knowledge management and capacity building opportunities to ensure an optimal understanding of these threats and the best way for how to convey all of the relevant information to the public. Again, thank you for inviting me to speak at this event. Thank you for the work that's being done by Nigerian Health Watch and partners, and I wish you and this event every success.
A round of applause for him. Thank you very much. The next on the goodwill message is Dr. Emmanuel Alassan. He is the Nigerian coordinator of Prevent Epidemics with the Global Health Advocacy Incubator. Dr. Emmanuel Alassan, you're welcome.
Thank you very much. You know, if you have been a teacher before, you know that, you like it when the clap, it gingers you, as we say here in Nigeria. Greetings from the entire team of the Global Health Advocacy Incubator, particularly from Vandana Shah, Senior Vice President, Health Systems Strengthening, as well as Ann Danelsky, who is Associate Director and the lead for the Prevent Epidemics program. It's indeed a great pleasure to be here again for the third Journalism Awards. This is a very, very important event because it recognizes the great efforts that journalists put in every year to ensure that the issues of health security are always in the front burner, to ensure that they do stories that encourage governments at different levels to continue to fund epidemic preparedness, which is extremely important. It is with great pleasure that we are extremely proud to be associated with Nigeria Health Watch, with NCDC, with other partners, with the journalists who make this event every year very colorful. I'm here with my colleague, Hamza Ablai, who is the Kano State Coordinator for the program. And he's saying hello to you all as well. So, one very critical thing I'd like to state here is the fact that we do not practice that thing we say all the time, that prevention is better than cure. It costs lots more. At a time, it was estimated that it costs 9 times more to respond or react to outbreaks than to prevent. Another study that was done, which I found on the internet, says actually 14 times more expensive to respond to epidemics, to outbreaks. And that is why it is important that we all need to work with the journalists to ensure that government at different levels prioritizes health security and to ensure that we don't all go to sleep. It is instructive to note that in the last 3 years, there's been increased funding. If you look at the budgets for NCDC, for instance, and for the other ministries, departments, and agencies that are part of the health security infrastructure, who are part of those implementing the National Action Plan for Health Security, the graph has been on an upward swing, thanks to the great work that everybody has done, and with the leadership of NCDC, because We've had the directors general at the helms of affairs that have really led the advocacy charge. But it is instructive to note that the budget for 2023 for the first time has dipped in spite of all the work that was done. This is typical of when, there is something catastrophic happens, everybody runs up and down, and then, the lockdowns got eased, everybody can go everywhere now, you don't need to pay so much money before you travel, and when you return, and so typically we are all already beginning to sleep, and so for the first time in 3 years after COVID, well, not really after COVID, but the euphoria, the excitement about everybody falling over themselves to ensure they do something is already dying. So this is the time to actually work harder, because if we do not do that, then the next big epidemic will come, next big pandemic, and then the cycle starts all over again. Is it not better that we work very hard to prevent rather than say, nothing's going to happen, COVID is gone, and then we have another big banger? I would like to thank all the journalists that have been working with us, with all the players in this health security space. I say kudos to all of you, kudos to those that put in, and kudos to those who will be taking awards out tonight. We want to encourage other journalists to join in this great work, because the work that you do is so important. Believe me, government reads, they look at social media, they look at what happens, they take the things that you write, the things that you talk about on radio and on television very, very seriously. Very quickly, I'm also excited that Nigeria Health Watch has brokered a partnership with Breakthrough Action. It looks like a very promising partnership, because I understand that they are going to be doing a fellowship, some training for about 6 months for journalists, and we look forward to a great partnership. We look forward to more journalists getting trained on how to talk about issues, write about issues that relate to preventing epidemics. Once again, thanks to Nigeria Health Watch, thanks to Vivian and her team, thanks to everyone that have come, thanks to WHO, thanks to ProHealth, thanks to everyone that is here. My prayer is that we have an enjoyable evening. Thank you so very much for being here.
Thank you, Dr. Emmanuel. Please, can we give him another round of applause? Thank you. Quickly, I'll be calling on the representative of Dr. Emmanuel Agogo, who is the country representative, Resolve to Save Lives Nigeria. He is Mr. Genome Danjuma. Mr. Genome Danjuma, are you here? All right. A round of applause as he comes to the podium, please.
Good evening, everyone. All protocols duly observed. My name is Danjuma Genome, a principal advisor and manager for Prevent Epidemics Project. We Resolve to Save Lives, Nigeria. So having listened to the previous speakers, right, and having been at the subnational level, I was once a state epidemiologist, and then now having a view at the national level, I can testify to the fact that we've had issues of sustainable funding at the subnational level. And again, we are seeing it at the national level. So we just recently had the NAPS operational planning. And then when it comes to where are the funding sources coming, right? So most is nil because the budget has been passed for 2023, right? So the challenge for funding still remains. And we want to thank Nigeria Health Watch for all the efforts at ensuring that we have the sustainable and sufficient funding for health security. So my work is also simple like that of Dr. Victor. So I'm also representing Dr. Emmanuel Agogo, the country rep for Nigeria Resolve to Save Lives. So I want to thank the organizers for inviting us to this very important and critical event, and also want to celebrate our partnership with Nigeria Health Watch, JHI, and others in this media space. So it gives me great pleasure to be here today to celebrate the media excellence for epidemic preparedness and response in Nigeria. As a global and now local organization, Resolve to Save Lives is working to strengthen public health systems worldwide to prevent pandemics as well as improve cardiovascular health. We are aware of the critical role which the media plays in public health management and information dissemination during public health events. Resolve to Save Lives has a long-time partnership with the media, both at the global level as well as the national levels. So this is reflected in the Resolve formula for progress. So we have the three formulas for progress. One is that we strengthen public health sector. So we accompany colleagues in the public sector, so like we do with the NCDC, Federal Ministry of Health, and even other development partners to accompany them to their desired goals. And secondly, we also work with accurate, timely, transparent data to keep progress on track. So by that, in the Prevent Epidemics stake, we know for Prevent Epidemics, really, we have been having challenges around having metrics. How do we measure progress, right? So the best we use now, we use the joint external evaluation, at least to tell us where we are. Nigeria is at 39 from the self-conducted assessment that we did in 2019, right? And then recently we're having some timeliness metrics. How fast are we able to detect? How fast are we able to notify? How fast are we able to respond to public health? And most recently, we have the 717, which the WHO Afro has taken to also implement as a strategy for health security in the Afro, WHO Afro region to be achieved between 2022 and 2030. That is, we should be able to identify any public health threats, notwithstanding within 7 days, and ensure that we notify to the public health authority that can take action within 1 day, and ensure that we have an effective response, at least initial, in the first 7 days of that outbreak or any public health threat. So I also want to thank the Nigeria Health Watch for this Prevent Epidemics hashtag. So I think that is a very good part of it. So the third one is really around strengthening civil society to pressure and support society organizations. So we support civil society to ensure that we partners are doing the right work, and also ensure that the policymakers in government are also doing what is expected. So the media plays a very crucial role in educating the public and disseminating information during times of crisis. In the face of COVID-19 pandemic, when we saw limited trust in people and public health advisories and interventions, the Nigerian journalists who rose to this great challenge, and they show exceptional dedication, professionalism in response to this coverage. So their tireless efforts have helped to keep the public informed and provide a vital source of accurate and very reliable information. They have helped dispel myths and rumors and have played an essential role in educating the public about protecting themselves as well as their loved ones. So the journalists and the media outlets being recognized today have gone above and beyond in their coverage of the pandemic, and their work has had a tangible impact on the health and well-being of the Nigerian people. So we must also acknowledge and appreciate all these sacrifices that have been made and the work that they continue to do. Many have put themselves at risk to give the public the necessary information. Also, all have worked to counter misinformation that was prevalent during the peak of the pandemic. In conclusion, I would like to extend my congratulations to all journalists and media outlets recognized today. Your hard work and dedication have significantly contributed to the fight against COVID-19 and other pandemics and epidemics in Nigeria. Surely, Nigeria will not forget these efforts. Thank you.
Thank you. Thank you so much. And next, we'll be calling on the Executive Director, Pro Health, Dr. Iko Ibanga. You're welcome, sir. Dr. Iko, you're welcome, sir.
Vivian, that's not on the schedule. That's congratulations. I've watched Nigerian Health Watch from the beginning, and it gives me great pleasure to see how far they've come. And not just strengthening themselves, but empowering other people. And you know, when it takes a team to make the dream work. And that's what Nigerian Health Watch has proven. And I'm so proud, and Vivian knows that I'm so proud. I've told her that, and doing this and doing it so well, this is the third year. And so we continue to encourage the journalists through these awards to say, look, what you're doing, you're making impact. You know, what you're doing, it's people are reading, believe me. I shouldn't tell this story, but even your president reads. Yeah, it's true. So don't think that you're wasting time when you write things, and don't think that they're not concerned about what is happening on the social media. And so, and like you said, you know, we used to watch Spider-Man, and we can all quote it. You know, you have great power, and with that great power, you have responsibility to keep reporting what is true. A lot of people died during COVID because of misinformation. That's the truth. And so as people that people read and people listen to, you need to know that you can save lives truly. And so it's a great privilege to be here to share in this very special day. And again, thank you for doing this. Thank you.
Thank you, Dr. Iko. Thank you, sir. Ladies and gentlemen, we're about to start off the award presentation that is next on the agenda. And I'll be calling up Kemi, Dr. Kemi Aboye, who is going to moderate this session. Dr. Kemi, are you around? Okay. Please, a round of applause for Dr. Kemi, please.
Hi, everyone. Good evening. I hope we're having... I'm sorry, but it just seems a bit too calm here. Everyone is looking all serious. It's an award ceremony. We're going to have dinner. But everyone is looking too serious, like we came for a workshop. People are writing. So can we do something really quickly before I call the winners? Just so everyone is pumped up. And when we introduce the winners, you're like, yay! Because this is way too solemn for an award ceremony. So could you walk up to someone you don't know and just say, hi, my name is, what's your name? Where do you work? Can we hang out after this? Hope you're not married. Can we just do that really quickly? I'll give you 2 minutes. Just one person. You need to stand up from your seats because people are turning to their neighbors now, which just defeats the purpose. Yay.
Flex my love, I want to impress, and I want to carry my love to a place she loves. I'm I want to impress, and I want to carry my love to a place she loves. Die who, or die who, yeah, or die who, die who, or die who, yeah, or die who, die who, or die who, yeah, or die who. My body calling, in your body, people. Loving you, they make me forget, say I get problem. By the end of the night, enter bathroom, fresh up. I want to flex my love, I want to impress, and I want to carry my love away to a place she loves. I'm a man, I want to impress, and I want to carry my love away to a place she loves. Die who, or die who, yeah, or die who, die who, die who, or die who, yeah, or die who, die who, die who, or die who, yeah, or die who, die who, die who, or die who, yeah, or die who. It's your bestie.
Baby fresh on the beat and it's killing them all, of course. It's killing them all, of course. Make we scatter this place tonight. Dance and sweat till lights in a fight. We must settle this thing tonight, yeah. Come, let us catch some feelings for night, yeah. And if you tell me, say make a bello, bello. I don't go waste time, but to do like
okay, now people don't want to sit down anymore. All right. We're done. See, you guys should have come early so you could do all of this earlier. Okay, should I test someone? Let me look for the most serious person here to test, to see if you... Okay. Let me not put anybody on the spot. All right, so we're down to the reason why we are here. We're here to celebrate some excellent journalists, people that have reported on epidemic preparedness and response. We need to fund it in a way that is sustainable. And you've heard a lot already about how important this is to the epidemic preparedness and response landscape in Nigeria, how the health sector's most prominent challenge is funding. And we see it very clearly in the health security space. So my first awardee is for the TV category. And her name, okay, I feel like I should build up the suspense a bit. So let me just tell you about some of the entries that we had for the TV category. We had some people do a bit about monkeypox, now mpox, and how was Nigeria prepared or not. We had an entry from Lagos TV that was basically about, the show is called Virus Beyond Borders. And she spoke to experts about how prepared Nigeria was, focusing on a state. If you're in the health security space, then you know how important subnational health security is right now. So that's really topical. It was really good to see a lot more journalists reporting on that. But the winner, oh, I thought her picture was there already. Okay, let me tell you about her before I tell you her name. She is a second-time winner of this award. This is her second time winning it. And she is a broadcast journalist, senior correspondent, and she has covered health beats since 2015. In fact, most people refer to her as Dr. Ogom. Oh, I said her name, I'm sorry. Because of how much she's been doing this, right? So the winner of the TV category, her story was about preventing, let me just read it so I get it right. Preventing and preparing for epidemics. And she sat with an expert. She first started with a very strong human angle piece, speaking about how prepared Nigeria was for epidemics and pandemics. And then she sat with an expert and really sought to dissect what the critical issues are. And one thing that came out clearly was funding, and how that funding needs to be decentralized, how subnational governments and how local governments need to start thinking innovatively about how to fund epidemic preparedness and response activities in their states. That was what she did, and it was insightful. It employed a good use of the data that currently exists, and it was engaging as well. So allow me to welcome, before I welcome her, I'd like to welcome the people who will be helping me present this award, because I'm not doing it alone. Please help me welcome Mr. Femi Stevens. Yes, he looks surprised. We're in the business of surprising people today. That's what we're here to do. Mr. Femi Stevens is the technical lead for food safety for the National Action Plan for Health Security. He is one of the most dedicated people in NAFS. There's hardly any meeting I go to that I don't see him there. So please welcome Mr. Femi Stevens, please welcome, from the Federal Ministry of Health. He will be helping us present this award. Also, help me welcome the representative of Dr. Walter Kazadi-Mulumbo from the WHO, who would be helping me present this award as well. Thank you so much. All right, so now to the person we are here to celebrate. You know, I thought there was going to be music and something, so that when she's walking up, there are like flowers thrown in her face. But anyway, please welcome Mrs. Karen Ezedimbu Ogom.
I was built to be the best, number one and nothing less. Lead me to my destiny. I have waited patiently. I have vision, oh I believe. I know I can count on me. So stand up for the champions, for the champions. Stand up, stand up, stand up. For the champions, for the champions. Stand up for the champions, for the champions. Stand up, stand up, stand up. For the champions, for the champions. Stand up.
Okay, thank you. All right, so please, you know what, just hand. Great, that works. And the awards to him. So he's going to hand it over to her. So, sorry, there's one bit of information I forgot to mention. We're doing this in partnership. We've already talked about all of our partners, the Global Health Advocacy Incubator, who are funding this. We've also spoken about the NCDC, who we work very closely with, LISDEL, part of a consortium that conducts this advocacy. But I also wanted to mention one of the partners, or one of the partners for this particular event, which is Breakthrough Action. Breakthrough Action Nigeria, who is in the process of designing a fellowship program for journalists. And that's where this is from. So every winner from today's award, in addition to a cash token, which I'm not going to tell you what it is, and the plaque that he gets, which they can go put on their shelves and show people. I'm sorry. They're also going to get a 6-month free fellowship. In the training program that Breakthrough Action is designing, which will basically focus on science communication and infodemic management and funding for epidemic preparedness and response, at the end of which your capacity should have been sufficiently built. Yay. But someone will come up here to tell you more about it after this award ceremony, because I see some media guys saying, really, why didn't I know about this? So you're going to hear more about it later. So please put your hands together for Mrs. Karen Ezedimbu Ogom. Congratulations, congratulations, congratulations. Thank you. Stand up. Thank you so very much. Thank you so much, Dr. Victor Tugumizenu and Mr. Femi Stevens, for helping me present that. Okay, so now to the next category. I feel like some people are wondering, oh, is she going to call me or not? This one, she's been surprising people. No, I'm not going to surprise anyone else. But so this was supposed to be presented by Dr. Gafar Alawode, who is ably represented by Deborah Adams, who is project officer at the Legislative Initiative for Sustainable Development. Please put your hands together for Deborah Adams, who will be presenting this award with me. Also make welcome. So I'm just being dramatic, apologies. Please make welcome Dr. This is the person I'm actually going to surprise. That's why I paused, because I didn't tell him. Dr. Geoffrey Okatubo, who is Director of Port Health Services at the Federal Ministry of Health. He'll be helping me present this award as well. And I'd like to tell you about the story that won this category. This is the print and online news category. And it was won by a really amazing writer. She is a senior health reporter at Premium Times. It's like she has fans here. Okay, and she okay. All right. So, I mean,
if I fail, then go laugh me. Now my mama now him bath me.
Okay, please wait. Let me tell them about this person first. I've not even said anything. Okay. All right. So, her story. I'd actually like to write about her story. Her story was about tuberculosis, and she used human angles and data to tell a story about the state of preparedness of Nigeria, particularly in tackling tuberculosis. She also brought in an angle that spoke to stigma, and with her story, she was able to do two things. She raised public awareness on the issues around funding for epidemic preparedness and response, but she also left a call to action in there for policymakers. And what else are we looking to do with our writing and our reporting? And she's someone who has won a ton of awards. Like, she sent like six awards she's won in the past. And then says to mention a few. And I'm like, wow, okay, so 6 times you won an award. And she goes where the story leads, just so she can make the needed impact to bring about change. She's passionate about this. She decided to dedicate her career to development and health reporting, and has been doing that effectively for a few years now. Please put your hands together for Mrs. Adenike Adebowale Tambe, senior health reporter at Premium Times.
Now my mama now him bath me. Them is excuse, they slap me. Same people when I turn, they go yab me. Alright, tell me where then they run all the hustle and they try sustain. Every Saturday, from Ilaja down to Costain. I beg, no carry my blessing run. Today now you, tomorrow fi be my turn. Show me love, no go show me python. We be the same for Oluwa Kingdom. So me say, celebrate me. Now when I day alive, appreciate me. Now when I day alive, not be say when I live this life, you go the fake I'm for my wife. Celebrate me. Now when I day alive, appreciate me. Now when I day alive, not be say when I live this life.
Thank you so much. Please put your hands together for Mrs. Adenike Adebowale Tambe. Again, congratulations. Hope you enjoy your 6-month fellowship and hope you continue to report excellently like you've always done. Great, thank you so much. So for the last category, please help me welcome. Okay, these ones are not surprised at all. Yay. So our partners for this event, the people who will be providing the fellowship to the winners of the category, are represented by Omolara Oyinlola, who is program officer at Breakthrough Action, Nigeria. Please put your hands together for her. She'll be helping us present this. And also, please make welcome Mr. Marcel Sati, Budget Office of the Federation of the Federal Ministry of Finance, Budget and National Planning. One of our biggest allies in the health sector. If you want to talk funding for health security, always happy to help. Please put your hands together for him as he comes to help me present this award. I didn't surprise you. Yay. All right. So the winner of this category, I'd like to tell you a bit about her. Okay. Okay, Mrs. Blessing Ifechukwude, I hope I pronounced that right. I'm so sorry if I didn't. Enabeli is the winner of the radio category. Okay, thank you. So she did a story about Mpox, and that story started with a vox pop that highlighted what people thought about our state of preparedness for Mpox. This was just around the time when Mpox had been declared a public health emergency of international concern. And she leveraged expert voices, including Director General of the Nigeria Center for Disease Control, the State Commissioner for Health of Lagos State, and she was able to tell a really good story about where the gaps existed in our preparedness for Mpox. She also brought in a human angle and curated the voices of people in the communities as well. And that made her story really impactful. So please, put your hands together for Mrs. Blessing Ifechukwude Enebeli, who is the Assistant Chief Producer at Voice of Nigeria. Put your hands together for her, please. Thank you so much. Okay, so just please don't leave. Can we have all the winners and all the presenters and Dr. Emmanuel and Vivian and can we just come up here, take a picture with all of the winners really quickly? And you, Dr. Victor, please step up here. Deborah.
We gon' celebrate and party with you. Come on now. Let's all celebrate and have a good time. Yeah, yeah. We gon' celebrate and have a good time. It's time to come together. It's up to you. What's your pleasure? It's a celebration. It's a celebration. Celebrate good times. Come on. Let's celebrate. Come on now. Celebrate good times. Come on. Let's celebrate. We're gonna have a good time tonight. Let's celebrate. It's alright. We're gonna have a good time tonight. Let's celebrate. It's alright, baby. We're gonna have a good time tonight. Yeah. Let's celebrate.
Don't sleep, don't sleep. Wake up. Collect your money. Wake up. Collect your money.
I'm not collecting money yet. Thank you so much. Okay, so are you done with this? Can we have just the winners, please? Yes, just the winners. Just the winners. Just the winners. Dr. Emmanuel, please stay back. Thank you. Please stay there as well. Omolara. Vivian, sorry. Yes, I did. Please stay back with the winners. What? Wait, sorry. What? Please, can we have the thing that's the theme of the fellowship? You can take this one first, then you still put it. It's our partner. You can take this first. Let's take this first, and then we'll take another one with the winning thingy. Maybe just one, because it won't fit into everything. One person's name. I don't think everything will fit in. Okay, you can turn it around.
Every little thing you did do to me, you sweet to me for body. She a loving fee follow me. Wow, 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 wow. Yeah, your bullet make her go crazy. I'ma get say you sure for me. Say make her withdraw money. Oh, no good and great. Make her carry your luggage. I define you for days. For days and no trouser fit to contain. Your body na baggage. So you know, see, I'm falling for love. Overdose me, your love they overdose me. Now you, I want me love you, I think of follow.
Okay, we're done. Thank you so much. Thank you. So to wrap things up, I'll just make welcome Omolara Oyinlola, project officer at Breakthrough Action. She's going to tell you about the fellowship. And for those who are interested, they can then learn more and know how to apply.
Live to die another day for you, baby. Quit my casting over ways for you, baby. The only time that you say that you hate me is when I take the last slice of pastry. Now I'm on the road.
Hello. Good evening, everyone. Good evening, everyone. Even if we're not excited for ourselves, we should be happy for the people that just won. And then I also wanted to ask, do we have only female journalists in Nigeria? Please, where are the men? What? Benji? We need to challenge our men. Congratulations to all the winners. And just like we've heard from some of the goodwill messages that we heard from partners, I want to just quickly amplify something that the Director General said about building the capacity of the media. Health journalism is a specialty. A lot of us journalists did not go to school to understand the science behind a number of infectious diseases that we're battling with today. So what the Media EIS program is all about is to build the capacity of our media professionals to understand the science of diseases. Now, when you understand the science of these diseases, you also know that there's a lot of misinformation out there. So how do you ensure that whatever you're putting out there is the right information? Now, when you have the right information, how do you charge the people, the public, to take positive actions for healthy behaviors? That's basically what the Media EIS program is all about. And we are challenging you when we roll out to please engage with the program, send in your applications. We would have people who will do the selection and get people to participate in that training program. At the end of the day, what we hope to achieve with this is to strengthen our health security systems and contribute to our IHR benchmarks as a country. And we're trusting that when we roll out eventually, we would get maximum cooperation from our media partners. Thank you.
Good evening, everyone. So with this, we've come to the end of the award ceremony today. Just to reiterate maybe what all the our honorable speakers have said around the role of the media in epidemic preparedness and response. We know that this role cannot be overemphasized or underemphasized. And so we hope that they continue in their good work that they've always been doing, but we know that more needs to be done, right? So I would like to use this opportunity to say a big thank you to everyone present here. Thank you so much for honoring our invite. I'd like to say a big thank you to our partners, the Global Health Advocacy Incubator, the Nigeria Center for Disease Control, Breakthrough Action Nigeria, Listel, Federal Ministry of Health. We'd like to say a big thank you so much for all the work you've been doing and all the support that you've been giving to us. So from all of us at Nigeria Health Watch, I'd like to say a big thank you. Thank you so much for coming. So please don't go yet. Please make sure you mix with people, greet people. There's food packed that will be shared and some little goodie bags that we would like to give you as well. So thank you so much for coming. Thank you.
No vex for me. Say I never call you since, but I hope that you are well. I hope you're my kid still. Every day I dey pray for you. Make you Baba God bless you. I never forget you. I won't forget you. See my shoulder.